If you or someone you love has been diagnosed with a myeloid blood cancer and told that a stem cell transplant is your only real option or worse, that there are no good options left, this video could be the most important 7 minutes of your year. Because right now, in 2025, a drug called Revumenib is rewriting what is possible for patients with a specific genetic mutation that was previously considered nearly untreatable. And the overwhelming majority of patients who qualify have never heard its name. Every year, approximately 20,000 Americans are diagnosed with acute myeloid leukemia. Of those, roughly 30% carry a mutation called NPM1 or a rearrangement called KMT2A, also known as MLL, in their leukemia cells. Historically, those patients faced some of the worst outcomes in all of blood cancer. Relapse rates were brutal. Treatment options after the first or second recurrence were essentially palliative. Doctors had little to offer except more of the same chemotherapy that had already stopped working. That is not an exaggeration, that is what the data showed for decades. That changed in December 2024 when the FDA granted full approval to Revumenib, sold under the brand name Revuforte, specifically for relapsed or refractory acute leukemia with a KMT2A translocation. This came off the back of the AUGMENT-101 trial, a pivotal phase 1 and 2 study conducted across leading institutions including MD Anderson Cancer Center, Memorial Sloan Kettering, and Massachusetts General Hospital. The results that drove that approval were not incremental. In patients who had already tried 2 or more prior lines of therapy, people who had essentially run out of road, the overall response rate was 63%. Let that number land. Nearly 2 out of every 3 patients who had failed everything else responded to this drug. Here's what makes Revumenib different at a biological level, explained as simply as I can make it. Certain leukemia mutations work by hijacking a protein complex called menin. Menin normally helps regulate how blood stem cells develop. When KMT2A or NPM1 mutations are present, they essentially kidnap menin and force it to activate genes that keep leukemia cells alive and multiplying indefinitely, like a switch stuck in the on position. Revumenib is a menin inhibitor. It physically blocks the abnormal interaction between the mutated protein and menin, which turns that switch off. Leukemia cells that depended on that signal stop proliferating and in many cases undergo a process called differentiation, meaning they mature into normal-looking cells instead of staying locked in their cancerous juvenile state. This is not chemotherapy in the traditional sense. It is a targeted molecular intervention. Now, who specifically qualifies? The FDA approval covers adults and pediatric patients 12 years and older with relapsed or refractory acute leukemia that carries a KMT2A translocation. However, multiple ongoing trials are expanding access in critical ways. The AUGMENT-101 expansion cohort is actively enrolling patients with NPM1 mutated AML at multiple U.S. sites right now. A separate phase 3 trial called BEAT AML Master Trial, coordinated through the Leukemia and Lymphoma Society, is examining Revumenib in combination with standard induction chemotherapy for newly diagnosed patients, meaning frontline therapy, not just salvage. That is a massive shift. If those results hold, we may be talking about Revumenib becoming part of initial treatment protocols rather than a last resort. On safety, because you deserve the full picture and not just the highlights. The most clinically significant side effect seen in AUGMENT-101 was differentiation syndrome, which occurred in about 15% of patients. This is a known complication from drugs that force leukemia cells to mature rapidly. It causes fever, respiratory symptoms, and fluid retention, and it requires prompt medical management with steroids. It is serious but manageable when caught early. QT prolongation, a cardiac rhythm concern, was also observed and requires monitoring. The important context is that for patients with relapsed or refractory disease who are facing survival measured in weeks to months, this side effect profile is widely considered acceptable given the magnitude of response data. There are currently 41 active or recruiting trials listed on ClinicalTrials.gov involving Revumenib as of early 2025. Several are combination studies pairing it with venetoclax, azacitidine, or intensive chemotherapy to test whether layering mechanisms produces deeper and more durable remissions. Early combination data presented at the American Society of Hematology annual meeting in December 2024 showed complete remission rates above 70% in NPM1 mutant AML, numbers that would have seemed implausible 3 years ago. Here is exactly what you should do with this information today. Go to ClinicalTrials.gov and search the terms Revumenib AML and menin inhibitor leukemia. Filter by your country and set recruitment status to recruiting. You will see the current landscape in real time. When you speak to your hematologist or oncologist, ask them directly, has my leukemia been tested for KMT2A translocation or NPM1 mutation, and have you reviewed the Augment 101 data for my situation? If they have not brought it up, that is not negligence, it may simply be that their patient load makes staying current on every emerging approval difficult. Your job is to put this on the table. Request a molecular pathology review of your leukemia if you have not had one recently, because mutation status determines eligibility and that information is foundational. If your current doctor is unfamiliar with menin inhibitors or dismisses the question, contact the Leukemia and Lymphoma Society at lls.org. They offer free one-on-one consultations with clinical trial navigators who know this space intimately. You can also call the patient services line at MD Anderson or Memorial Sloan Kettering directly and ask about their Revumenib trial access programs. Many institutions have financial assistance and travel support built into trial participation. The door is open. You just have to know to knock on it. Thank you so much for watching this video, and if you are here because you or someone you love is fighting acute leukemia, I want you to know that the fear and exhaustion you are carrying right now is real and it matters. You are not overreacting by searching for every possible option, you are doing exactly what you should be doing, and this channel exists to make sure you find what you are looking for. I want to ask you something in the comments. Have you or your loved one had molecular mutation testing done on your leukemia? And did your oncologist bring up menin inhibitors, or did you have to find this yourself? Next week we are covering a topic that is generating enormous attention in the autoimmune community, a video called the JAK inhibitor trial your rheumatologist may not know about yet. And if you or someone you love has rheumatoid arthritis, lupus, or an inflammatory condition that has stopped responding to biologics, you will not want to miss it. Hit subscribe right now so that video lands in your feed the moment it goes live. You are not alone in this, and no one who finds clinical trial news should ever miss a breakthrough that could change the course of their life.